He's someone very close to New Image, and he has been with New Image for years using the product and also dispensing it to his patients, those needing proper care and nutrition. He is a friend to our chairman, Mr. Graham Clegg, and also to many of our members. He also used to go to some cities before to conduct presentations for New Image. So from what we can see on the screen, hindi ko napabasahin lahat yan, he's a very talented doctor, no? And you can just see there all his accomplishments, achievements, mga trainings niya and his affiliations, mga books na sinulat ni Dr. Bien. And he has a regular program no, sa mga radio stations, DZRH, DZBB, DWIZ, even sa TV5. As a matter of fact, Dr. Bien will be doing a radio program after this event. And we are just very thankful that he is able to accommodate us, no, kahit busy yung schedule niya.
Rockstar yan, si Dr. Bien.
Yes, our Dr. Rockstar. Let's welcome and type 11111 to welcome Dr. Edwin Bien. Hi, Doc.
Hello, everyone. Hello there.
Hello,
Hi.
Doc.
Thank you very much, Sir Boyet and Miss Cynthia, for making this possible again, despite the fact na nagkaroon nga ng bagyo in many areas dito sa Visayas, no? So our condolence doon sa mga nagkaroon ng mabigat na problema wherever they are, and to those who are able to watch this later on kapag may connectivity na sila, well, nakikidalamhati po kami doon sa nangyari sa lugar ninyo. But we know the Filipinos are very resilient at kapag pinag-uusapan ay Pasko, walang makapipigil niyan sa Pilipino.
Nako, correct ka dyan.
Whatever ipaghahanda ng mga Pilipino yan kung kailangan nilang gumawa ng paraan. So, this talk will still be about the habits and the lifestyle of the Filipino. So, okay, mag-alala. Lahat naman po makakaangat at makakabawi din with God's grace, no? So,
Amen.
Maybe we should start. Yeah, we should start. Ang napili po na pag-usapan ng management ng New Image International is anything about the gut. When you say gut, anything about our digestive system. Because since the holidays are here already, we know Filipinos are going to be starting on binge eating, binge drinking, and we'll go to different eat-all-you-can restaurants. Alam naman natin yan, kung 17 o 18 ang ulam na nakahain doon, titikman nating lahat yan. Hanggang sa busog na tayo sa leeg natin. Thinking na kailangan mabawi ko yung 300 pesos ko o yung 500 pesos ko. So a lot of the Filipinos will feel itong nakasulat na ito, yung hapdi ng sikmura or hyperacidity, and there are many reasons for that one. Shall we go to the next slide, please? The next slide will show us na marami sa atin ang nag-aakala na inaatake na tayo sa puso once na humapdi ang ating sikmura dahil tumutulay ito dito sa gitna ng ating dibdib. That part is called the sternum. Ito po, yung buto na nararamdaman natin sa gilid. Sad to say, totoo yun, no, na kapag ang nararamdaman nating kirot is right here in the middle of our chest, sa sternal area, that is where the heart is, and that is where a heart attack usually starts. Ang kagandahan, when it's a real heart attack, it doesn't go to the left side of the chest kamukha ng nakikita natin. Yung hawak-hawak ng lalaki, that is the left side. More likely, that is not a heart attack because a real heart attack is in the middle of the chest. But, andun din, Sir Boyet, ang ating esophagus. So, napagkakamalan natin ang hyperacidity as a real heart attack, which will bring us sa emergency room ng alas 2, alas 3, o alas 4 ng madaling araw.
Panic mode na.
And that happens usually in the evening. Ginigising tayo, nararamdaman na natin yung parang tumatayo yung ating balahibo, sumasakit ang ating batok, and that will bring us with fear to the nearest hospital. So, going to our next slide, ito ang problema. Kapag ito ay tunay na heart attack, more likely it is a one-time, big-time sensation. But when it is persistent, pabalik-balik, lalong-lalo na kapag ito ay after a big meal, or once you want to sleep already, lie down already after your dinner, or even after your lunch, more likely it is not the heart, but the digestive system. But when you go to doctors, the doctors will not be contented. Mas gusto ng doktor i-test ang ating mga puso because baka mamaya matindi na pala. Hindi lang pala sakit sa sikmura ito, kundi sa puso talaga. But with a simple stethoscope, alam nyo ba, a doctor can already tell you whether it is from your heart or it is from your digestive system. Very simple. When it comes to the heart, the doctor will listen and hear a regular thumping sound. Yung tunog labdab, 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 labdab. That is a good heart sound. A bad heart sound will sound like this. Labdarap, 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 labdarap. Do you know? Do you get it? Do you know yung sound na yon? Yeah. Now, what if it is about the digestive system? All the doctor need to do is ilalagay ang stethoscope dito sa ating sikmura, no? Sa gitna mismo, sa ilalim ng sternum. And what will the doctor hear doon sa kanyang stethoscope? Ito, kumukulo at parang pumuputok ng mga bubbles, yung plok, 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 plok. That is called borborygmi. I will repeat that para may natutunan yung mga distributors natin. Borborygmi. That's B-O-R-Y-G-M-I. That means yung bituka natin has a lot of acids, and that acid is with the digestive juices and liquids, kaya para siyang mga bubbles na nagpuputukan. And that is how we detect na ito pala ay sa digestive system. Now, what happens inside our stomach? Tingnan natin yung next slide. Do you know how acidic our stomach juices are? Sa next slide, makikita po natin. Alright. The pH level of the stomach may be compared to different substances na familiar tayo. Now, we know na yung nasa upper part, the middle is called the neutral. It is 7. A pH 7 is neutral. Going to the right, 8, 9, 10, 11, and 12, that means it is alkaline. And going to the left, 6, 5, 4, 3 is acidic. Now, our resting stomach, that means a stomach that is not hungry, that has not eaten a full meal, just while you're sleeping, will have a pH of 4. Slightly acidic na rin yun, 4. But when we are eating very high protein, especially at bedtime, ewan ko nga ba, bakit kapag nakikipag-date tayo, to impress, ang ino-order natin para sa ka-date natin, steak. Di ba pwedeng ang i-order natin sa kanya ay saluyot, sayote, o munggo? Because when we order and eat meat, that is when the acid goes very low to 1 or 2. Now, how acidic is 1 or 2? Look at the picture sa pH scale underneath it. A battery acid, the one that can burn your clothes or your skin, has the same pH almost as the stomach. It is like the pH of your muriatic acid, the acid that we use for cleaning the toilet. So, nagtataka tayo, if it is so acidic, how come hindi nasusunog ang bituka natin? Well, because we have a mucus layer inside. Yung mucus layer na yon protects the stomach. But there are instances na nawawala yung mucus layer na yon. What is a mucus layer? Yun yung parang sipon. And that is normal inside our stomach. And what are the instances na yung mucus layer na to ay mawawala or at least ninipis man lang? We can see that in our next slide. When the acid starts going up towards our esophagus. Ang tawag natin doon, acid reflux. Some of you have heard of it already. Yung iba, ang tawag nila ron, GERD or G-E-R-D, gastroesophageal reflux disease. What happens? Tingnan natin yung litratong ito. The esophagus is the tube. Tubo yan. Yung sa ilalim ng tubong yon, yun ang stomach. Yung kulay berde, yan yung acid. Now, iba ang lining ng stomach sa lining ng esophagus. Ang esophagus ay napakanipis ang kanyang lining. Wala siyang mucus layer. So, kapag yung pagitan ng dalawa, which we call the sphincter, is permanently open, that means the acid can go up already the esophagus and will burn. Masusunog. Literally, mararamdaman natin yung init. Mararamdaman natin hapdi at kirot doon sa ating sikmura, which means yung esophagus natin nasusunog na. So I know your next question is, bakit bumubuka? Bakit umaakyat yung asido doon sa esophagus? Dapat sa stomach lang. And this is when we keep on eating and eating beyond the capacity of the stomach. Yun, the moment na magbo-burp ka na, that means punong-puno na yung ating tiyan. Yung kapag ang pakiramdam mo, yung kinain mo ay sobra-sobra na nakalobo na ang iyong tiyan na it's up hanggang dito na sa leeg, that means nakabukas na yung sphincter ng esophagus and the stomach. And the acid can start going up there. Nasusunog ang sphincter. And there are people na permanently nasusunog na ang esophagus, which you can see on the picture below. Ang tawag doon, esophagitis. Nagkakaroon ng scar ang esophagus na ito. And these are the people who will constantly complain ng pangangasim, pagsakit ng kanyang tiyan, at pagsakit ng kanyang dibdib. At ang lahat na ng medication ng mga antacid and other treatments by doctors is not enough para matulungan siya. So, iingatan natin. We should not be eating sobra-sobra sa kakayanan ng tiyan natin. May nagsasabi nga, kaya mahaba ang buhay ng mga Buddhist monk na nandoon sa Cambodia and other Eastern countries because they eat frequently but not too much. When I went to Cambodia, may nagsabi sa akin, why they reach up to 90 to 100? The same way like our grandparents, maabot ng 90 or 100. Sabi kasi nila, mas mahaba ang buhay nang mas konti ang kain. Mas maikli ang buhay ng taong laging kumakain. So, that is why probably intermittent fasting for some people works. Okay? So, take note of that. If you have hyperacidity, if you have GERD, if you have esophagitis, malamang you have been eating too much. Let's go to our next slide. Ano yung nararamdaman nila? Ito na yon. GERD means gastroesophageal reflux disease. If it progresses, ang tawag na ron, gastritis. Let's go to the GERD first. Take note of the picture on the left na parang may apoy. Talagang nag-iinit ang dibdib. Dahil doon, yung iba, they feel nauseous and they vomit. Naduduwal na sila. Hindi nila napapansin, pero napapansin ng iba, you can see on the extreme left ng picture, may bad breath na sila. Acid can cause bad breath. And no matter how much you go to your dentist, kahit anong gawin ng dentist sa ating ngipin, the bad breath will remain. Ang tawag doon, halitosis. So there are many people who does not know that they have halitosis and the other people are too shy to tell them. Next, May mga tao na nakakaramdam sila ng parang lagi silang may sore throat. Meron sila, laging makati ang lalamunan. This happens because when we are lying down, the acid slowly creeps up, pakonti-konti lang, but it irritates our throat, our larynx, and pharynx. When it does that, yung iba nakakaramdam ng hirap sa paghinga or difficulty breathing. Next, nagkakaroon sila ng persistent cough. Ubo sila ng ubo. And later on, bukod sa chest pain, makikita natin sa baba na picture, when it becomes gastritis, the person has to bend and double up kasi nararamdaman na niya talaga yung kirot. What happens inside the stomach pag may gastritis? From the name itself, gastritis means gasgas yung bituka. There are small lesions in it. At yung gasgas na yon, pwedeng mag-progress pa. Next slide, please. Ito yung progression when we go to the next slide of gastritis. Makikita natin on the next slide, etiology factors. Ano yung etiology factors? Next slide. That means what causes the gastritis? One, alam ba ninyo na may bacteria? It is called H. pylori na nabubuhay sa sugat ng bituka. Wow, ang acid na nun ha. The stomach is already acidic and yet may bacteria pala na gustong-gusto niya doon sa sugat tumitira. They can withstand the acidity. And stress can propagate this a lot. Irritants can also propagate the bacteria to grow. Ano yung mga irritants na yon? Alam niyo na, yung mga inuman sessions, yung inuman magdamagan, ayan. Of course, aging can also be a factor dahil habang tumatanda tayo, numinipis naman talaga ang lining ng ating bituka. And on the right, you will see other diseases. Bakit kasama ang other diseases dito? Because as we grow older, baka tamaan yung ibang mga distributors who are listening to us right now, dumadami rin ang ating maintenance medication. At akala natin, those maintenance medicine can only affect our kidneys, our liver. Hindi natin alam, it can also damage the lining of our stomach. So, what am I trying to say? We have to keep that bacteria out because yung bacteria na yon can progress from gastritis to real ulcer. When you say ulcer, pwede ka nang sumuka ng dugo. Pwede ka nang dumumi ng kulay champurado. That means there's bleeding inside. And that ulcer can again progress to something more severe. Ang tawag na doon, stomach cancer. So, that bacteria is something that we have to control. It is something that can be treated with some natural products that we will be discussing later on. So, yan pa lang ay GERD na naging gastritis na naging ulcer. What else can cause itong pananakit ng ating tiyan? Alam niyo bang may mga tao na masakit ang kanilang tiyan tapos itinutulog na lamang? Perhaps some of you have done that. Kumain kayo ng hapunan, you ate your dinner, it was quite heavy, medyo parang naimpatyo kayo, hindi kayo natunawan ng mabuti, para mabawasan yung nararamdaman natin, itinutulog na lang. And what can happen to us? We can see that on the next slide. Wow! Totoo nga ba na may condition as they call na bangungot? Ano ang dahilan nito? For medical doctors, we do not have a term for that. So we do not say it is bangungot. But there is a pathology that is happening inside our body. Bakit tayo binabangungot? At anong organ ang apektado kapag tayo ay binabangungot? The pancreas. Ang Tagalog niyan, lapay. Bakit naaapektuhan ng pancreas which may lead to bangungot? Because we Filipinos have this habit of eating too much carbohydrates. Hindi tayo mabuhay ng walang kanin. Kailangan ang lunch at dinner natin laging may kanin. Kapag may party, may handa ng kanin, may handa pang spaghetti. Tayo naman, pinapatong natin yung spaghetti sa ibabaw ng kanin At hindi tayo nakokontento, kumukuha pa tayo ng tinapay. A lot of Filipinos are probably doing this. Ipinapalaman ang pansit sa tinapay. Ipinapalaman ang spaghetti sa tinapay. And that is devastating for the pancreas. While we are sleeping, the pancreas has to double time ng trabaho niya. Ang inilalabas ng pancreas is both insulin and enzymes. Yung enzymes na yun is called amylase. Yung amylase na yun has the capability of dissolving the pancreas. So imagine, inilabas niya yung enzyme na amylase, and yet the amylase dissolves the pancreas and other parts of our stomach area, our digestive area. And what will happen? While we are sleeping, we could have bleeding. Ang tawag namin doon, hemorrhagic pancreatitis. At ang taong ito ay uungol. At akala nung katabi niya, nananaginip lang. So pinipilit gisingin. But in reality, kaya umuungol ang taong to because that person is suffering from pain. And that person is bleeding already. And the blood pressure is going down. When the blood pressure goes down, no blood goes to the brain and the breathing will stop. And it can cause death. So ingatan natin. Before sleeping, preferably not to eat too much carbohydrate. Preferably, our dinner should be at 7 p.m. That will give time na 2 hours before we sleep at 9 p.m. Do not sleep within an hour after eating. Kailangan may an hour or 2 hours so that hindi tayo bangungutin. Do you follow? And try not to eat too much, ha? Pansit at tinapay together with your rice. I'll show you how a pancreas looks like on our next slide. Ito yung lapay. It is colored yellow, as you can see on the picture on the left side. Yung lapay or pancreas produces insulin and the enzyme. The insulin is to digest glucose or sugar. The enzyme is to help digest the carbohydrates. Now, if you take a look at the picture sa ilalim, ito yung pancreatitis means the pancreas is inflamed. The person will keep feeling pain kahit gising na siya. At kahit anong gamot na antacid ang ibigay sa kanya, hindi nawawala yung kirot na ito. So, ano ang treatment for pancreatitis? Very simple. It is fasting. And preferably, instead of eating solid food, we will just be drinking our liquid meal. And you know that we have several products that are in liquid form that is possible para sa mga taong may pancreatitis. Next slide, please. Now, this pancreas will be affected by what we call mukbang. Some of us are copying the Korean style of going to, how would you call a Korean eat-all-you-can restaurant? Samgyup. All right. And we order as much as we can. Ang mangyayari, we overstimulate our digestive system. And there are people hindi kontento with just eating. Especially sa handaan, lalo ngayon, na holiday season, we like to drink with our meals. Once we mix eating with alcohol, that is a surefire way of developing pancreatitis. So, if you must eat, eat only, but limited. If you must drink alcohol, drink only, but not with meals. I hope you follow that one. At least give it a 2-hour difference between eating and drinking any form of alcohol, whether it is brandy, wine, or a stronger whiskey, or beer. Do not drink it with your meals. What will happen if we do that? Aside from pancreatitis, it will stimulate the bacteria. It becomes food for the H. pylori, the alcohol, and the carbohydrates. Let's go to the next slide. That is how the bacteria looks like. It's like a hot dog shaped greenish bacteria with some flagellates, as we call it, some tails, as you would call it. Now, they like to go inside the wounds of the gastritis, as you can see on the picture on the lower side. And then it likes to burrow. It's like a screw. It goes inside and deeper into the tissue because it likes to stay in the muscle of the stomach wall. When it does that, you will feel like you want to vomit. And there are people, when they vomit blood already. Then it becomes a stomach ulcer or a duodenal ulcer. Now, this is very hard to treat. Hindi ito nakukuha ng patableta-bleta lang ng mga antacid. Sometimes, doctors have to come in, open it up, and sew it. Tinatahi talaga ang sugat na ito. Dahil kung hindi, tuloy-tuloy ang pagdurugo. And once bleeding cannot be stopped, we have some people succumb and die from a bleeding ulcer. So, iiwasan natin yung mga pinayo ko kanina. Now, there are people who like to eat chicharon. They like to eat sinigang, but preferably sinigang na baboy. And they like to eat yung taba mismo ng baboy. And they mix with a little patis, a little sili, and they savor it kapag naglalangis talaga yung labi nila. Kapag may handaan, the first place that people go to is the lechon at kinukurot-kurot yung balat ng lechon. And if that happens in the evening, the next slide will show us kung ano ang mararamdaman natin. This slide will show us na it will cause inflammation in our gallbladder. Because it is the gallbladder that contains the bile. Saan galing yung bile na ito? Depository lang naman ng gallbladder eh. Galing sa atay. Bakit gumagawa ang atay ng bile? Kasi kumakain tayo ng mamantika. Hindi kayang tunawin ng stomach acid ang mantika. It has to stimulate the liver so that the liver will produce the green substance, yung tinatawag nating apdo, which is bile, para tunawin ang mantikang ito. Ang mangyayari, yung mantikang ito ay maiipon ng maiipon. This now will be called cholesterol stones. At ang stones na to, or bile acid stones, will accumulate sa loob ng gallbladder and they can become big. Pwedeng magsimula muna sila as a sludge. Makikita natin sa picture or ultrasound sa ilalim, a sludge is like putik. Para lang siyang makapal na lupa. Pero itong lupang ito, kapag ito ay nako-concentrate dahil sa parati nating pagkain ng mga mamantika, the bile will keep on stacking up, bibilog na ito and will become stones. Initially, parang buhangin. Later on, para na silang munggo. And later on, para na silang buto ng mais. And we have seen some people na ang bato talaga nila, sinlaki na ng ubas or grapes. And this is gallbladder stone. Ang problem dito, pwede siyang bumara. At ito ay surgical emergency na. So again, if I may suggest, kung kakain din lang tayo ng mamantika, i-reserve natin yon during lunchtime. Never during dinner time. Now, there are people na hindi nila maipaliwanag bakit nakakarinig sila ng parang kumukulo sa kanilang dibdib. Kruk, kruk, kruk. Yung binanggit ko kanina that normally naririnig namin sa bituka because bumubuka na talaga yung kanilang diaphragm. Now, who are the people na bumubuka ang diaphragm? We can see this on our next slide. Ito yung mga tao na lumalaki na ang kanilang waistline. For men, anything above 36 and 37 inches. For women, anything above 34 inches will slowly be the reason for the diaphragm to open up. And when the diaphragm open up, makikita niyo sa picture above, the stomach can go up and migrate sa ating dibdib. Ang tawag na rito is herniation or hernia. Ang kilala kasi nating hernia, yung inguinal hernia o yung sa singit lamang. But there are a lot of people na ang hernia nila nandito sa dibdib na kasi umaakyat na yung kanilang bituka. So again, what may I say this? Iwasan po natin ang sobra nating pagtaba. Iwasan din natin yung paglapad ng ating waistline because that will be a reason for our diaphragm to open up. Now, there are people who do not know what to do. They have gone to different doctors, and doctors will prescribe to them a lot of medications, like I do. Pero hindi kasi ako naniniwala that a person should be taking so much maintenance medicine. Naniniwala ako in mixing their synthetic medicine with something that is nutritional ang approach, because nutrition will help control any ulcer formation, any acidity in our stomach, and the propagation of this bacteria called H. pylori. Now, there are people who cannot tolerate many medicines as well. So what can we give this kind of people? Let us go to our next slide. People who are pregnant. People who are pregnant and are breastfeeding. So if they suffer also from all of those diseases that I mentioned a while ago, this is what I usually prescribe to them. This is a study done by a Michael Lakshin, a doctor, together with Sergio Schwartzman, and they have seen that by giving colostrum to people, they can help a lot of their children as well as the person be protected against, as you can see, enteric pathogens. What is enteric pathogens? That means many bacteria that is present in our digestive system. So as you can see, it is very helpful for a pregnant person, a post-pregnant person, as well as people who has a lot of pathogens or bacteria inside their digestive system. Next slide, please. People with inflammatory bowel disease. That means people who has to go to the toilet a lot of times, very frequently, almost 3 or 4 or 5 times a day. Sila yung hindi natutunawan. Sila yung mahina ang panunaw. That means they lack a lot of the immunoglobulins. And these are factors that we can see in colostrum. Ano ang action ng immunoglobulin? You can read that in the middle part of the slide. It has antimicrobial property. It has bioactive molecules as well. So, as you can see doon sa bottom line, it is very effective for many gastrointestinal conditions. Next, we have a lot of people with different viruses and bacteria inside our body. Mga bacteria na hindi nako-control by antibiotics, including viruses that we are so afraid right now, including COVID. Now, the presence of colostrum in our body will propagate PMNs. What are these? Polymorphonuclear leukocytes. What are they? They act like Pac-Man. They go inside our circulation and look for the viruses and the bacteria. And they eat them and they destroy them. So by the action of what we call phagocytosis, you can read that doon sa last line. That means they eat it up. We are able to control many infection in our body. Next, our body is also important. Sorry about that. emergencies. Our body is also important to receive a lot of nutrients. Now, these nutrients can come from many supplements that we have out there. Pero hindi lahat ng supplements contain what is contained in our colostrum. It contains oligosaccharides. It contains pro and prebiotics that is very important in the propagation of the good bacteria. You cannot get that from ordinary vitamins and minerals. So, why alpha-lipid colostrum? Next slide. Because of digestibility and absorption. There are many milk products out there, but important that we digest it, important that we absorb it. And this is why the alpha-lipid is superior in quality compared to many other different colostrum in the market. Next slide. It is very rich in proline. And proline is an essential amino acid that is important for our growth. Hindi lang growth para tayo ay tumangkad o tumaba. Growth of our organs that are damaged. To repair, to regenerate. Hindi lang yon. Next slide will show us it also has anti-inflammatory property. Ibig sabihin, nape-prevent niya ang many pains and inflammation inside that happens in our body. Yung mga karamdaman natin, natutulungan with the anti-inflammatory property of colostrum. Next slide. It has immunoglobulins. Alam naman natin, it has antimicrobial property. All the different kinds, from fungus to bacteria to viruses. And last but not the least, of course, it has lactoferrin. Next slide, please. That means it builds up our digestion so that we are able to digest our food properly and thereby maximizing the nutrients that we get from what we eat. To sum it up, our next slide will show us colostrum at 12 o'clock is a very good nutrient. At 3 o'clock, you can see it is important for cell growth. At 6 o'clock, it has antimicrobial property. And at 9 o'clock, it has immunomodulation, which means it protects and boosts our immune system. So, the next slide will show us it is up to our choice. Should we take so much medication as you can see on the slide on the upper part? Or should we eat fresh fruits, vegetables, and the good food together with colostrum? It's our choice. Next slide. And this is a better choice. We have the powder form, and the next slide will show us we have the capsule form. Both are very beneficial to our health. So I hope wherever you are, if you can, whether you are sick or just trying to prevent many illnesses in your body for your loved ones, you try and take colostrum. I thank you very much.
Wow, thank you so much for that, Dr. Bien. I know medyo tight ang time natin ngayon because you still have to go to your radio show. Mga ilang minutes tayo for Q&A.
Well, at least before about 10 minutes, as you mentioned.
Okay, 10 minutes. Let's start. Okay.
Okay.
Wala tayong time. So first question, Doc. Ano ang cause ng bukol sa liver and ano ang dapat daw gawin?
Wow! Ang cause ng bukol sa liver is many reasons. Yung iba, simple cysts lamang. Simple cysts will happen because of our diet. As I mentioned kanina, too much protein, too much fatty food. But there are people who develop tumors. Yung tumor na yun could be two things. One, more commonly, it is metastatic tumor. That means, galing siya sa ibang parte ng ating katawan na nagkaroon ng tumor at lumipat sa atay. At alam naman natin, yung liver is the last bastion or the last defense of our body. The next one is primary hepatoma. That means, doon sa atay na mismo, tumubo yung bukol. And there are many reasons for that. Again, bisyo is number 1. Cirrhosis due to alcoholism can lead to tumors. Parasites or worms can also cause bukol sa ating atay. So there are many factors.
Okay, next question. Good PM Doc, yung problem ko po every morning, parang mahigpit ang lalamunan tapos malapot ang laway.
Acid yan. That is gerd. So, alam na natin, yung binanggit natin kanina. If it is acid, then choose your food. Choose your food. Not too much carbohydrate, but eat more vegetables, a lot of fruits, less meat, a lot more fish.
Okay. Sorry, I missed the part on gallstones. How can colostrum help those with gallbladder stones?
Nabanggit ko nga po kanina, no? Ang kagandahan kasi ng colostrum, it is an unsaturated fat. Whereas yung pong mga bato sa ating abdo is caused by fats that are saturated coming from the oils that we are eating. So it neutralizes the saturated fat.
Okay, is it advisable with pancreatic cancer?
Wow, pancreatic cancer. Like the problem of the one who owns iPhone. Tama? At
Yep.
alam naman natin, pancreatic cancer is a very deadly form of cancer. Yun nga lang, magkaroon ka ng pancreatitis can cause death dahil sa bangungot. E di how much more ang pancreatic cancer? So, a person with pancreatic cancer usually does not respond to the usual chemotherapy and radiation, but will respond to very, very good nutrition. So, lalayo ka pa ba when it comes to good nutrition? Colostrum na alpha lipid is one very good option.
Okay. Boyet, from your end? Yep.
Okay. Doc, meron din akong question dito na natanggap. Yung father
Yes.
ko died of pancreatic cancer.
Sorry.
Is it genetically acquired, Doc?
No.
Okay.
That's a good thing. It is not genetically acquired, but not the pancreatic cancer, but a father or a mother who developed a tumor has given you 50% of his or her genes. Alam naman natin yung sperm niya at yung itlog ng nanay mo mixed together to become you. So, there is a 50% chance na baka magkaroon ka rin ng another form of tumor. And we don't want that. So, kailangan maingat din tayo sa ating kalusugan.
Yes. Another question, Doc. Merong schools of thought na sa ketogenic diet na being advocated by our chairman na pagka high fat tapos low carb ka and you're eating veggies, that is okay. Ang masama raw yung high fat, high carb. Is that true?
Okay. A lot of people have asked me about ketogenic diet. I will say, yes, it is good. However, dito nagkakamali ang mga tao in choosing the right kind of fat. Akala nila lahat ng fat, and that includes burger, bacon, balat ng lechon, at saka makapal na taba ng sinigang. Wrong. When we say high fat, we get that fat from tuna, salmon, ulo-ulo ng isda, and vegetables. That kind of high fat. Hindi high fat from pork.
Na, patay ako. Sige.
High fat ka nga, pork naman ang source. You know why? You know why? Because a high fat from pork or even the fat of the beef can clog the kidneys. So, Nagsisexy ka nga, pumapayat ka nga, but nagka-clog yung kidneys. Remember, nephrologist does not agree on too much protein sa kidney diseases. Yan.
Okay. Thank you, Doc. Cynthia, ikaw.
Okay, there's a question here. Nakaka-constipate po ba ang Coke? Anak ko palaging nagsi-CR. Putol-putol ang pagsi-CR niya, pabalik-balik. Coke addict din daw siya.
Now, the problem there is, siguro nakita niya po sa inyo that you are taking Coke or drinking Coke. Try mo na panlinis ng toilet bowl ang Coke. You will see the following morning, ang puti-puti ng toilet bowl mo. Now, ganun ang nangyayari sa ating stomach. Parang toilet bowl na naaagnas o napapanipis niya yung ating bituka. Now, it's up to you. Would you like to continue that with your child?
Doc, pwede po bang uminom ng Alpha Lipid Lifeline ang may bukol sa liver?
Why not? I have suggested that. Whether you're sick or not sick, for preventive purposes, Alpha Lipid Lifeline Colostrum is a very good option for you.
Okay, we have 5 more minutes. How could it help a person with fibroids in the lungs? Post-COVID effect daw. Yeah.
Fibroids in the lungs post?
How could it help a person with fibroids in the lungs? Post-COVID effect maybe?
Oh, okay. Ang tawag dyan, long haul COVID. Actually, fibrosis ang tawag doon, no? When you say fibroids kasi, kaya nalito ako, that means myoma or bukol sa matris ng babae. Now, fibrosis is different from fibroids. Yung fibrosis means peklat na nandoon sa loob ng baga natin. Nagpepeklat siya kasi pinagbahayan siya ng virus. Now, itong maganda, sa ating katawan, may capability tayong mag-repair and regenerate as long as you provide the necessary repair materials. Do you follow? Kapag binigay mo sa ating katawan yung necessary ingredients to repair, nakaka-repair siya.
Okay. Good evening, Doc. Member po ako sa Facebook group ng LCIF or yung low carb group na nag-push po sila ng no rice. Is it healthy? Is it a healthy thing in a long run na wala na daw rice? Will it affect
the truth
health?
is yes. Yes. Yung rice kasi, source of carbohydrates natin. But there are many na pamalit sa rice. Kamote, kamoteng kahoy. Alam nyo na, there are countries that do not eat rice and they survive as well, di ba? So, it is also very possible. Nasanay na lang kasi tayong mga Pilipino na hindi tayo nabubusog kung walang kanin. Ano tayo Kain karpintero.
Kain laborer.
Kain laborer.
Doc, yung
nakasanayan.
yeah, yung iba nagkakaroon ng problem sa heart after they got COVID. Is that true? And how can do you think colostrum can help?
Definitely. Myocarditis is a complication. Fibrosis of the lungs is a complication. Blood clots is a complication. There's many complications. So kailangan natin maalagaan ang ating katawan. Wag na nating hayaan that we develop COVID. Whether wala tayong COVID o nagka-COVID tayo, it is very important that we take a very good product. And Alpha Lipid Colostrum Lifeline is a good choice.
Okay, last question, Doc. What is the best time to drink colostrum? You always say drink it in the morning, but there are people who are drinking it in the evening also. Is it okay?
Actually, very simple. Siloso yan Ayaw niyang may kasamang adobo, menudo, o lechon sa iyong tiyan. So, whether you drink it in the morning, middle of the day, or in the evening, what is important is you drink it before you put food in your stomach. At least 30 minutes before meals.
Okay. I think we have read all the questions already. Wala nang pahabol. From your end, Boyet, meron ka na-receive?
Wala na. Wala na.
So I guess this ends our session, and we would like to thank Dr. Bien for being with us today. Kahit busy siya sa kanyang schedule, na accommodate niya yung pag-change ng schedule natin. Thank you so much, Dr. Bien.
Marami pong salamat, Dr. Bien.
It is a pleasure. Maraming salamat din po sa lagi po ninyong pag-imbita sa akin. It's a pleasure na makasama kayong muli. And I hope everyone will be healthy and happy this coming New Year and Christmas celebration. May God bless you all.
Merry Christmas!
Thank you, Doc.
Okay.
Thank you rin po.
Thank you, Dr. Bien, and thank you to all our participants today. And we wish you a Merry Christmas. This is our last event before Christmas. So, Merry Christmas, everyone.
Merry Christmas, everyone.
Thank you for attending our session, and watch for the recorded video. Thank you, Dr. Bien.
Thank you, Doc. Thank you.
Thanks, everyone.
Doc.
Thank you, bye.
Bye-bye.
Bye-bye.
Thank you, bye-bye.